I oversee all the clinical spend here at the Homerton as the main business partner across 2 different divisions, including surgery, women's, neonatals, emergency, resuscitation. The Homerton were approached by Ansell to have a look at a value-based procurement involving surgeon gloves. This opportunity enabled the Homerton to become a latex-free environment, which reduces the risk of latex allergies for both patients and staff. We had over 150 cases last year of latex allergies. Our patient pathway and outcomes have improved by becoming one of the first trusts in London to be latex-free. The project was welcomed by most departments. We had a bit of an issue with our trauma team. The Ansell team and myself worked collaboratively with the trauma team to remove these issues, and we had full staff satisfaction at the end of the project.
Claire Flatters. I'm the Service Manager for Trauma and Orthopaedics at Homerton Hospital. I work very closely with the whole of the multidisciplinary team on a daily basis. We started the discussion a little while ago with regards to the potential of changing the gloves over. Obviously, latex-free is a good thing. From a staffing point of view, some people have an allergic reaction, maybe not a serious allergic reaction, but they have some issue with regards to latex. All of these people, I have met people at previous trusts, and we had to find alternative gloves for them. So we have that on hand already. You're not looking around the hospital trying to find that. We do have an option for latex-free, which we didn't have previously. So we have that option for people who maybe have an issue with latex, may not have highlighted it previously because there was no other option. When we have any change project, it's a bit challenging. Not everybody's on board, not everybody's keen. So we start the communication with everybody. Then we decided, let's pilot this within trauma and orthopaedics. We got feedback from everybody. The majority of the feedback was positive feedback. There will always be occasional one person who thinks, I don't notice any different to the previous ones, but it has been very positive and the implementation has gone very well.
My name is David Borderman. I'm a consultant orthopaedic surgeon here at Homerton Hospital. The trust is going to move across from latex products to non-latex products to try and reduce the risk of latex exposure down to the patients and to the staff as well. My experience of the transition was that we had a number of different gloves to trial. My worries were that the latex-free gloves that we were going to trial and going to use potentially in the future wouldn't be as good a quality and as good a feel as the latex products which I've been used to and the ones that I've been using throughout my career. In my experience, the PEI gloves which we were trialling were excellent in comparison to both previous latex-free gloves which I've used, which I'd found to be quite stiff and thick and difficult to use. They felt very different from the latex gloves which I'd used routinely. The new PI gloves felt much more at a par with latex gloves, and I found them easy to transition to.
The value-based procurement enabled Homerton to reduce down our codes of gloves that we ordered. We reduced down from 36 codes to 4 codes. The reduction of codes means that we are in a position where we have more space in our storage departments. It means that we have less orders being placed on a daily basis. The added benefit of this obviously is cost reduction, as well as reduction of codes, man hours, deliveries. We saved the equivalent of 25 FTE days for our staff to be active in other areas. This project enabled Homerton Hospital to save circa £25,000 on our purchases of surgeon gloves.
My current role is the junior business partner, and I work alongside Sumit, so he's my line manager. So we'll manage anything in stock, procurement-based projects within the trust for day stay unit, main theatres, pre-assessment unit, and so on, maternity unit. So there's quite a big role to fill. So now we're not keeping us too much boxes on hand, so it makes it more straightforward for the staff to come and find the different sizes, because now it's more, it has minimized like workloads within this end and the staff upstairs as well. Now this is more simple to manage when it comes to ordering or just check you have the right amounts of stock on hand. So that's make life a lot easier for us now.
I'm a supply chain manager, so basically all the needs of the trust, the stock need of the trust come through me. I have a staff of nearly 7 staff works under me. So they're the one who actually look after the need of the wards, like what syringes, what gloves, all the disposable stuff, what they need and how much they need, what type they need and all that all comes to us. Homerton is a team and we all work as a team. We cannot live without the clinician can't live without us basically. So to perform, to safeguard somebody's life and well-being, they need us. And we need to provide those life-saving goods to them on time, efficiently, so they can carry out their duties basically. To have the product on time, that is a challenge basically, and how you're going to have it. But are you going to have it? Sometimes value for money is not good for us. It's no point having the saving money when the goods are not delivered on time and I cannot save somebody's life. What's the point of that? So I need to have that efficiency. Efficiency is the most important thing for me, is to have that thing right on time when I need it. When it comes to the surgical gloves, the main problem was the type of gloves and the brands of gloves. So we used to have 5-6 different brands of gloves and also coming from so many different areas. Some directly buying it, some buying it from supply chain. It wasn't efficient. Efficient is time-wise, not efficient as money-saving wise either, because you're wasting money buying it from lots of different companies, but the same product. So what we did is to work with Ansell's very closely, work with our end users very closely, and that basically solve our problems. So one, efficiency, space we saved, the money we saved, and the most importantly is now we're not confused with different colors of gloves sitting there, with different brands sitting there basically. Some of those brands basically were 25 in one glove box. That wasn't really helping us as a space-wise. The packaging of Ansell new gloves as well, it's 50 to 100 in it instead of having a 25 in it. So that's kind of compact the size, helps us in a way. In theatre, we have to scan, if I have to scan A to Z, it's 11,000 lines. So 11,000 line, say 1 minute a line. So just count those, how many minutes I'll be standing there and wasting my time. So by going from 24 to 12, that just straight away save you around about 12-15 minutes on gloves only. So each and every minute counts. I like to add one thing though, that the way this whole process, the whole, shall I say, what we call that trial, which was arranged by Ansell and our team here in procurement, it was very nicely done. We did not have any hiccup, we did not have any problems like the goods coming in or goods not coming in, who shall we show that to, or any of those things. So the end users, they get credit, everyone get credit basically for that they all gel together and they all work together and they all give us the honest feedback. And that's all we needed, the honest feedback from the end user and obviously the support from Ansell and from our own team. And the result is just speak for itself.
It also means that we have less vehicles on the road coming to Homerton, which reduces our CO2 carbon footprint. The NHS has a target to be net zero by 2040. This value-based procurement has assisted Homerton to align with the NHS and become more resourceful and more efficient. The partnership between Ansell and Homerton provided great trust between the two, which means better patient outcomes, better productivity for our staff, and the Homerton being in line with NHS sustainability model. This project has enabled me to further understand value-based procurements, which I will be using in projects moving forward.